Hello and welcome to this special edition of Be Well, Be Whole. We have returning with us today Nurse Patricia Addie-Gentle. Nurse Gentle. I just love that name. And today we are discussing COVID-19 vaccinations and how some of us are navigating these very pressing issues. Now, we need to say up front that this is not a discussion that is intended as medical advice. It is meant only as a means to share information and experiences. Now, before we dive in, we invite you to subscribe to our YouTube channel. When you go to YouTube, just search Be Well, Be Whole and click the subscribe button. We would very much appreciate it. And there you will find all of the Be Well, Be Whole conversations that we've had on life, spirituality, and wellness. So let us begin with you, Dr. Lartey. So a few days ago, you posted a picture. And what happened? What was the picture? What led up to the picture? And what happened after that?
Well, Wednesday, January 20th was not only the inauguration day of the new President Biden and Vice President Kamala Harris. I had come to the conclusion that I was going to get the Moderna vaccine, the COVID-19 vaccine, and I had it scheduled, my first shot scheduled for that evening. So on the evening of Wednesday, the 20th, I, went down to the Emory Decatur facility and had that first shot. Now, coming to that decision was not without some contention,
Mm-hmm.
because I share and completely understand the distrust that exists, especially for people like us with the whole medical thing, and especially the vaccine development and so on. So I did spend some time um, critically exploring, because I come to it with a hermeneutic of suspicion, like many of
Right.
us do, and I do think that it's real because it is based on facts, that we have not always been well treated
Mm-hmm.
or taken seriously by the medical people. And in the development of vaccines, we have often been not we've been, kind of like the guinea pigs in this. And so I did have some suspicion, but precisely because of that suspicion, I decided to really investigate, look closely, and look carefully about what went into the development, and how, as a person above the age of 65, um, the reality is, that we are determined as persons at greater risk. The effects of COVID-19 for our age group are typically more severe, and the risk of death much higher. So I wanted to do everything that I can. Also because of faith, you see, because for a lot of people of faith, there have been all kinds of notions and ideas around COVID-19 itself, and then about the protections, the public health protections that have been stipulated, like wearing a mask and socially distancing. There have been those anxieties about whether this whole thing was not directed towards minimizing or in some way destroying our ability to practice faith. And I have had to think about that, and to come to the conclusion that no, actually, seeking life
Mm.
and doing all that we can to promote life is the greatest testimony of faith. One of my favorite scriptures, coming from the sayings of Jesus,
Mm.
is where Jesus says, I am come that they may have life and have it in all its fullness. That phrase is preceded by the expression, the thief comes only to steal, to kill, and destroy.
Right.
And as I thought about my own faith and my response to this, I realized that, in a sense, the virus comes only to steal, to kill, and to destroy. And so anything that one can do to promote life, to be anti death, destruction, and stealing, is actually what faith, and especially faith in Jesus, requires. So I had come to that conclusion that I need to be far more in line with everything that promotes life, that preserves and that promotes life. And so, yeah, so the decision to go take the vaccine was the result of that whole process. I might also say that it also relates to my ancestral heritage, which is also a part of my faith thing. You see, my maternal grandfather, Agbenye Gandoku, my maternal grandfather was a church planter,
Mm.
and a person of faith who spent a lot of time, teaching about Christian faith um, and also about prayer and so on. So prayer is very much a part of my heritage.
Mm-hmm. Mm-hmm.
My paternal grandfather was what we call in Ga language chofan che. Chofan che. Chofan is medicine, herbal medicine. Che is father or chief or expert.
Right.
So my paternal grandfather was a chofan che, an expert, if you like, an expert in herbal treatment. So you see, so in a sense, he was the scientist. You see, and all of the scientists, all of the herbal practitioners use medicine to promote life. They use herbal medicine, and especially a lot of herbal medicine is similar to vaccine in this sense. The vaccine stimulates your body to produce its own, it's a natural production of those things that, the antibodies and so on that will fight the disease.
Right.
And that's what the Chofa Chairman, that's what they do. They give us herbal treatments that will promote the body's own natural resistance to
Mm-hmm.
illness.
Mm-hmm.
So, I may say consulting my grandparents would result I could almost hear my paternal grandfather saying, "Go ahead and take the tufa. Go ahead and take the medicine that will protect you." I could also hear my maternal grandfather saying, "Pray, definitely pray." And so I do both of them. I pray and I take the medicine because I believe that the two are important in promoting life.
Thank you for that beautiful narrative, Dr. Lartey. Now, I want to ask you this. Um, there are some who would say that the traditional healers do not promote um, vaccinations or medicines that are mass produced. Do you have anything to say um, to that question?
Actually, the opposite is actually the case, because the traditional healers, they actually often, because it's herbal medicine that they are engaging in, they actually often are teaching people to make use of the herbs, so to if you like, in a sense, the production of the herbs is what they do. You
Hmm.
see, the so they will be about multiplying, multiplying the usage of herbs and so on. So they would find no problem at all
Hmm.
with the mass production,
Hmm.
because it would fall in line very much with their notion that, the multiplication of herbal medicine is actually very, very important in the well-being of people. Now, I may say that I know that there's some anxiety that people have about the elements that go into the production of
Hmm.
the vaccine. And I mean, I was so fascinated, particularly about the Moderna vaccine, because one of the people in the forefront of the production of that was African American woman,
Uh-huh.
Dr. Uh, Kismikia Corbett,
Right.
a 34-year-old Black scientist. So I mean, for me, I mean, that I mean, I take Moderna today, tomorrow, and forever, because my sister was a part of the production of that thing,
Mm.
and she's not going to give me nothing that's going to cause me harm. She's going to make sure that, so I mean, just on that level alone, that, I know that in the past there was, there was real cause for anxiety about what, went into these things. But I think that, in fact, largely as a result of that, and the exposure or the exposition of the malpractice around that, now people are far, far, far more um, conscious and far more careful about these things than was the case in the past.
Right, right. And I will say this before I bring Nurse Gentle in: context matters.
Mhm.
So when you, Dr. Lartey, are talking about the traditional healers, you're largely referring to West African traditional healers. And I think it's important to kind of make a distinction between the African traditional healers and African American um, traditional healers who are using, yes, or pulling from their ancestral memory
Yes, yes,
for that, but also in a very troubled context in which Black people, in particular, have been mistreated in the United States. So I
yeah,
just wanted
yeah.
to make sure we put that out there. Nurse Gentle,
Mhm.
please talk to us about your experience. Thank you
Well,
for being
first,
with us.
yes. First, I'd like to just say thank you so much for including me in this discussion. I feel that this is so vitally important right now and also so relevant. um, in times like these. We really need to empower ourselves with knowledge before we take action. And so I really appreciate being a part of this. But yes, I too had reservations about taking the vaccine. And I can say that January 21st, I had my first injection. So, being a part of healthcare, I knew that I needed to do something in the way of prevention so that, if I am exposed, that I have some immunity, I have some antibodies in my system. Now, my reservation and the biggest concern I had about both vaccines was that, I've gone through clinical trials. I have participated in a couple, and I have promoted medication that had just finished going through clinical trials. As a matter of fact, I worked on a team as a contracted employee for Pfizer, not with this vaccine, but with the diabetes medication.
Mhm.
So
Oh, so just to remind everybody, you are tell us about what you do. You mentioned diabetes patients, so I just want to remind everybody.
yes, and I am a registered nurse. I am also a certified diabetes educator.
Mm-hmm.
And so part of my job is to encourage, to empower, to inspire, to let my people with diabetes know that they are at risk for a lot of various conditions that, because they're immune suppressed in so many ways. And so vaccination is one of the things that we really push for people with diabetes, whether it's the flu vaccine or whatever might be epidemic or whatever is going on at the time. So I have spoken about vaccines in so many instances, but for this particular vaccine, as I was getting ready to say, there was a big push to get it to market much sooner than what we are accustomed to when we go through the clinical trials. And so knowing that we had a person in office who was big on trying to win this, re-election and trying the very best to get this drug to market a little sooner than what we are accustomed to, really made me a little apprehensive.
Okay.
I wanted to make sure that it had gone through all of the trials and, that it was safe and the efficacy was where it should be. So, having worked as a contractor with Pfizer for diabetes medicine at one point, knowing Pfizer's reputation and knowing that Pfizer would not put anything out there, I just don't feel in my heart of hearts that Pfizer would attach their name to something that was not useful and helpful or that was detrimental. So it made me feel a little safer.
Yeah.
I had made up my mind that I too would do the Moderna because the problem I had at that point was that perhaps um, the integrity of the Pfizer vaccine having to be on the, below zero temperatures, being shipped and brought to the dispensing area. And, I just had a problem thinking that perhaps the potency would be compromised. However, when I did schedule myself, I had not a clue as to which vaccine I would be taking. But I
Right.
knew once I got to the facility, I would definitely find out before I got injected. And of course, it was Pfizer. So I had the Pfizer vaccine. But I do feel that either way, either one, you are really doing the best towards prevention and towards safeguarding yourself from COVID. And our community most definitely needs to put that in the forefront of our minds. And I do know about the distrust and how we've been treated in the past. And even today, you see some things that I see some things that I know are racially motivated even in healthcare, or maybe not even racially, but just it's a disparity. When you look at people, even literacy, the way that instructions are given, the way that follow-up instructions are given, aftercare kinds of instructions.
Yeah.
And sometimes it's a little more thorough if it's with someone who seems to be a little brighter, a little more intelligent or whatever than someone else who's understanding. Perhaps you have to repeat yourself, or you may have to write it down, or you might have to make sure that it's in terminology that's understandable,
Yeah.
or you may have to do pictures rather than written words. And there are people who have problems with numeracy. They don't understand, especially when I'm teaching blood sugars. If I give parameters, you want to be between here and here, sometimes it's not understood, because you wouldn't believe that there are people who don't realize 300 is greater than 200.
Yeah.
Seriously. And so, in my experience, I also, I like to include families,
Yeah.
someone else who is able to go home and interpret or repeat what was said. But knowing how things are today, most people have to go to appointments alone. So, I encourage, take your cell phone,
Yeah.
make sure that you're on audio, make sure someone else is hearing this so that they may interpret it a little differently than the way you have interpreted. But there are ways around all of these different barriers that we do encounter. So this is so relevant, and we need to empower our people. Now, one thing I want to say is, when I got to the facility, I noticed, and my husband and I were together, and I asked him, I said, how many people of color did you notice coming through the door to get this vaccine? Because in my memory, I couldn't remember a single one except the two of us. And so it made me think about Stacey Abrams and how she had such a big campaign to get people to understand the need to vote.
Yeah.
It's so relevant. This is so timely. It is so vital in our community. And, there are people who don't have transportation.
Yeah.
There are issues, a lot of issues around this. So, in order to safeguard the health of our community, we need to work hard.
Yeah.
Work hard. We need to eliminate some of the stigma that has been attached, and we need to make sure that our voices are being heard. So I am very happy to be a part of this discussion.
Mm-hmm. Thank you for listening to the both of you. Accessibility to information, accessibility and how things are written and how things are communicated. All of these, accessibility to facilities, getting there and having someone to advocate for the marginalized and the oppressed and those who struggle with literacy. All of these are major, major issues in our communities still. And I love that you mentioned Stacey Abrams, Patricia, because her ethic, her is just what we need to push these discussions and to get what our people need so that we can make informed decisions.
Absolutely.
So just for just a few statistics here that I've pulled from the CDC website. But before I do that, I will say I have not gotten the vaccine yet. My spouse has a week and a half ago got his first injection because he is an essential employee at a school here in Atlanta. So he was able to get the vaccinations. What we have discovered is Myself and our two teenage sons are in the gray area. I'm calling it the gray area. And we don't qualify. We're not essential employees, and we're not 65 years old. So it has been difficult to find a facility that will give us the vaccination so far, because there are people who need it more than we do medically. Tommy got the Pfizer injection.
Mhm.
So on the CDC website, and I will include these links in the chat or the comment section, but Black or African American non Hispanic persons are 3.7 times more likely to be hospitalized with complications of COVID 19, and 2.8 times more likely to die.
Mhm.
Um, Also, American Indian or Alaska Native non-Hispanic persons are 4 times more likely to be hospitalized. And when I say 4 times, this is more so than white persons. 4 times more likely than white persons to be hospitalized, and 2.6 times more likely than white persons to die. Um, these numbers are from the CDC website. I also want to highlight an article that some of you may have read. This is an opinion piece posted on NBC News on Dr. Eugenia South. And I will quote her out of the article. I am a doctor and have seen Black patients treated with disrespect, their concerns and symptoms dismissed. I reflected on this complex relationship between racism and mistrust as I considered whether to take the COVID 19 vaccine. As an emergency medicine physician with regular exposure to COVID 19 patients, I knew I would be prioritized for vaccination. However, for many months, I was decidedly and definitely against being among the first to get the shot. Instead, I planned to wait and see how others did with the vaccine. And many of us have felt the same way. And she goes on to say, I suppose I am weary of the very system to which I have dedicated nearly 2 decades of my career. So these concerns are not unusual, and we want to be sure that we provide space for naming these things. And how Dr. South came to get the vaccination is she begins with, as Dr. Lartey and Nurse Gentle have stated, with education
Mhm.
and reading all that she could on how these vaccinations were manufactured, how long were they in trials, um, who were on these teams. She read all of that, and I encourage us all to do the same thing. Um, Tommy, my spouse, he had no reservations with getting the vaccination as soon as it was available, and he's on a war path to get the rest of us vaccinated as well. Now, I will also offer that he is a head of a department, and this department is predominantly Black, and he has had sessions with his employees, with doctors, so to explain what these vaccinations do and how they are taken, and someone to be on hand to answer all of their questions and concerns. This is very, very important. So, although we're not giving advice, I would like to offer, if you have the power and the
Mhm.
position to help people get educated, please do so. Please do so.
I may say in that very respect that I serve in a congregation,
Mm-hmm.
immigrant church, here in Atlanta, and we set up a COVID-19 task force
Mm,
within the congregation, made up of nurses and medical people, as well as health educators, and we've got some pharmacists also in the congregation. So we all kind of like got the task force together to keep abreast with the science, as well as the education. And so this group has helped us with education regularly in the congregation, and helped us to ensure that we have sought to keep the protocols. So our services and so on, which have almost exclusively migrated to Zoom and
mm-hmm.
so on. When we have had a couple of in-person things, we've maintained the social distancing, the masking, and so on, as an expression of faith, as an expression of our understanding of faith. I may say next week, the service is being given over to the pharmacists in our congregation to
Mm-hmm.
talk to us about the vaccine. See, these are practicing pharmacists, so at least people will take their um, professional opinion seriously. I think that it is important for us to address our suspicions and um, our experiences of disparities. I think that we need to we you know I don't think that we need to think that those who are suspicious are just uneducated or wrong.
Right,
I think
right.
we need to, I mean, all of us have to deal with that, because that's the reality around us. And the way in which we deal with it is to get the information, get the knowledge, so that we can make informed choices, and also help each other.
Yes.
you know so I mean, I want to go on that campaign,
Mm-hmm.
just like we've been saying about Stacey Abrams, that let's go get this is something that will help us, precisely because of the statistics that you just gave. We are disproportionately affected by this virus, so whatever we can do to prevent it, we ought to be in the forefront of doing it.
Mm-hmm.
Because them folk, excuse me to say, they're not going to be as concerned about us,
Mhm.
you know, as we need to be about ourselves.
That's right. Mm-hmm. That's right.
Yeah.
Any final words, Nurse Gentle?
Um, I think we have pretty much covered most of the bases, but I do think about those people who have been shamed and blamed as well, because so many times in healthcare, people avoid care because of the shaming and the blaming, and they feel that they have gotten to this position, it's their fault,
Yeah.
or it's something wrong with them, or they didn't do it quite right, or they don't want to go to a facility where they are not able to complete the paperwork and complete an appointment because they're shameful, and they don't want anyone to realize that they aren't able to do the paperwork. And so those are the kind of
Mm-hmm.
issues that surround healthcare sometimes that we don't even think about, but we have to find solutions for all of that.
Thank you. Thank you
Yeah.
so much.
I do want to emphasize that this is, I mean, I think that the analogy with the fair fight movement I think is very, very, very relevant, especially in Georgia. Look at the effect of getting the vote
Mhm.
out.
That's right.
Look at the transformative effect that it has had. In a similar way, I want to be the public health fair fight educator. I want to say, hey,
Yeah.
we need to go out, just like we went out to vote, we need to go out to get this vaccine for our own good, and to make sure that our health is maintained and is strong, and yeah, and all that we can to promote health. Let's do it.
Yes, indeed. And I will end by saying that when you get the vaccination, if you decide, in any case, if you don't, when you get it and after you get the second shot, still continue to mask up,
Yes.
still continue to maintain your distance and to keep down your exposure. Wash your hands. Maintain the same measures that we've been for almost a year now. So that wraps up this wonderful segment. Thank you, Nurse Gentle, and thank you, Dr. Lartey, for engaging this very important topic. Remember to visit us on YouTube at Be Well, Be Whole, and subscribe. Thank you for joining us. If you have any questions, um, you can ask us, but we might just send you to your primary care doctor, depending on the nature of your question or your comment. In any case, we invite them. So have a good one. Be well and be whole.
Thank you.
Thanks.
Thank you so much.